Farm so hard, the employees wanna find me, and then wanna hire me. What's 100K to a guy like me? Could you please remind me? Farm so hard, this ain't easy. Working late nights, you best believe me. My grades can only go A's. Never wanna see another B unless I'm Jay-Z. Farm so hard, let's get paid.
This is Morgan Greer.
This is Micaela Hayes, and you're listening to another episode of the Farm So Hard Ambulatory Care Podcast.
Hi, everyone, and welcome to the Farm So Hard Ambulatory Care Podcast. We're so excited to have you back for an episode where we're going to take a deep dive into collaborative practice agreements or collaborative practice with pharmacists with the Avant Institute. And I'm so excited to have my friends on with me today. I would say they're the subject matter experts on this topic. So I have Dr. Jessica Sinclair, and she's currently the Director of Education and Research Outcomes at Avant Pharmacy and Wellness Center and the Director of the Fellowship at Avant Institute. We also have Dr. Mariana Wilbur, who is currently a faculty pharmacist and Assistant Director of the Fellowship at Avant Institute and a clinical pharmacist at Avant Pharmacy and Wellness Center. So welcome you both. I cannot introduce you as well as you can and your story of how you got here. So Jessica, I would love to hear your story of how you got to where you are and what training you've done up to this point.
Yeah, and I will say my introductions are always like kind of an introduction to the Institute as well as myself. So I always make that joke during our fellowship interviews. But I joined the team as a resident from 2017 to 2018 when we were still RX Clinic Pharmacy. And from that experience, I really wanted to explore what it looked like to be immersed in the community setting as well as the ambulatory care setting. And I think that's something unique about our organization is you see that blend. And so I told our boss and pharmacy owner, I wanted to know what it was like to start a clinic from the beginning. And she said, be careful what you ask and wish for because it can happen very quickly. And by the next day, she found a clinic and had a place for me to really establish working with a provider collaboratively on services like the annual wellness visit, chronic care management, and remote physiologic monitoring. And I will say it was a whirlwind of an experience, and I learned a lot along the way, you know, the uniqueness of each provider and how to communicate with them. And from that experience, and really even during pharmacy school, I was really passionate about education. So my role did change a little bit to where I was less embedded in the clinic setting and more working on training our pharmacist team. So internally, externally, that's really what we do through the Avant Institute is to empower other pharmacists to be able to pursue these models. So that's really where the fellowship came about. We realized that we didn't necessarily fit the box of a community pharmacy residency. So we wanted to explore what sort of alternatives were there for us and how could we really spread this message and empower other pharmacies to be able to bring on fellows themselves. So that's kind of how I got to where I am today. And with that, I'm happy to hand things over to Mariana.
Thanks, Jessica, and thanks, Micaela, for having us. So I was one of the lucky recipients of all of Jessica's training and education on the fellowship. I did the fellowship from 2022 to 2023 with Avant internally. We do have external sites all across the country, which is really interesting to learn how these kind of collaborative relationships can work across the country. But after the end of my fellowship year, I got to stay on with Avant, helping to do some of our just community pharmacy type projects that Amina will throw at us, including pharmacogenomics, which I really enjoy. But then I've also got to do some with the Avant Institute side and helping to set up some of these collaborations with clinics across the country. And I've enjoyed kind of figuring out that puzzle of how to make it work in all these unique locations. And I'm excited to help with our fellowship coming up this year. But outside of that, I'm also with a clinic down here in South Carolina, just to be outside of that Avant umbrella and kind of figure it out on my own as I go as well. But yeah.
That's so cool. I love that you were in North Carolina and South Carolina because I'm kind of on the border and I just finished taking and passing my MPJE for South Carolina. So I'm very glad to have that behind me, but I'm in your boat of like North Carolina and South Carolina. And there's a little bit of differences. Do we're going to get into it, but I'm excited to learn the collaborative practice differences from your perspective in South Carolina as well. That's awesome. The first time I met you guys was at the symposium that Avant holds. I don't remember the full name. I will definitely let Jessica tell us what it is.
Yeah, so back in 2023 is when we had our first ever Business of Collaborative Care Symposium. And the idea was to bring together not just pharmacists, but other healthcare professionals who are really advocating for working together to improve outcomes. So we had physicians there, we had practice managers, but really a lot of pharmacist teams represented as well as vendors who kind of really pushed the needle for pharmacists in those spaces as well. So it was our first ever one, and we are excited to be hosting our next one coming up next year. And so from that experience, I think we really saw providers, their eyes open on how they can work together with pharmacists in a way that is sustainable. So it was really nice to be able to bring everyone together and have that experience, and also meet you, Micaela, at that event as well.
Yeah, it was so interesting. I loved meeting you all. And Amina Abubakar, who is the founder of Avant, she is just a force to be reckoned with in the pharmacy space. And I was just so excited when she pointed me to you guys, because you guys are like the brains behind all the collaborative practice stuff that she's doing, and I love it. But it was just such an interesting and amazing experience at that symposium, because you got to see the pharmacist sit down with the provider and give a talk about how they come together to do different things. And it's all in different spaces. I mean, there was a physiatrist, that talked, and he was from, I think, California or somewhere way far away. And I was just like, that was so cool.
Yeah, he's from New Jersey. We did have some providers from kind of all across the country. And I think with Amina's connections, she's really big on bringing people together. So we hope to see the same in the upcoming symposiums. But you're exactly right. A variety of providers, whether that's nurse practitioners, physicians, PAs. I know Mariana got to speak with her collaborating providers. So it was definitely great to hear all the unique perspectives that people had from different settings.
Yeah, so awesome. So we'll get all the information on how you can learn more about it and join the symposium for this year in the show notes and at the end of the podcast. All right, the first thing I want to start off with is laying a good foundation for our talk today. So can you describe what a collaborative practice agreement is, or a CPA, for a pharmacist practitioner working, for our listeners who may be familiar or may not be familiar with this topic?
Yeah, definitely. So for collaborative practice agreements, when we're thinking about the perspective of a pharmacist, typically it's that formal agreement between a pharmacist and a provider, and that may be a physician or another type of provider, that allows that kind of pair to work together more collaboratively, and for the pharmacist to work independently. So the supervising provider typically diagnoses whatever condition it is that they want to have managed, and they'll refer that person and that patient to the pharmacist for management. So through that collaborative practice agreement, the pharmacist might be managing medications, they might be managing disease states, ordering labs, and really that's all defined within that collaborative practice agreement as to what that looks like and what the provider has approved in terms of supervision. So we see a lot of variety, I think, in terms of what that looks like, and it could be a pretty diverse number of disease states that are being managed by pharmacists versus in other cases limited to where they might be managing diabetes as an example. So with our pharmacists, we typically see them managing a variety of conditions under that CPP that we see in North Carolina. But for the collaborative practice agreement, it's defining that formal agreement between those two parties.
And I'd like to just highlight early on that it's so important to constantly share the value of a pharmacist as you're working under this formal agreement, because we don't want to break trust or go outside of what was set in the formal agreement, but so many of the disease states that we're able to help with all intermingle. So when we're thinking about diabetes and CKD, or non-selective beta blockers and how it can be affecting COPD, things like that, it's important to keep sharing that with the providers so that you can expand on that formal agreement and keep showing the value of the pharmacist. That's what we're here to prove through all of our collaborations, and hope others can do that as well.
Yeah, that's really helpful and a great insight and perspective from you all. One thing that I want to highlight for our audience is we're in the North Carolina area, as we mentioned earlier. So CPP is Clinical Pharmacist Practitioner, and it's a designation that pharmacists can get in North Carolina. And it's basically like a collaborative practice agreement where you have a scope that you can practice within and prescribe a group of medicines in that scope or order labs, and it's all in an agreement with a group of physicians or a physician. Just wanted to make that clear for you guys. All right, the next piece I want to get into is your perspective on CPAs and advocacy behind CPAs that you've been involved with. So from your personal perspective as a pharmacist, what's the significance of a collaborative practice agreement or a CPA? And then what advocacy efforts have you been involved with that is directly correlated with CPAs?
Yeah, for me, when I think about the pharmacists and significance of CPAs, one of the things that comes to my mind first is really allowing the pharmacist to highlight the value that they bring to the care team. Of course, it is a collaboration, and so we're not independently managing the patients that we're working with, but it allows the pharmacist to highlight their skill set and medication expertise and management of disease states, and really having that unique lens in looking at a patient. I know that pharmacists are trained very differently from providers, and when I was conducting kind of an interview with one of the providers that I was working with, he shared that he valued the pharmacist's insight so much because it was so different from how he was trained. He said, if I bring a nurse practitioner on or a PA on, they're trained very similarly to me versus a pharmacist completely different. And that's great because it brings a skill set that they don't currently have on their team to be able to think through and address patient care needs a little bit uniquely. So I think the CPA in particular, it allows a pharmacist to function a little bit more independently because as pharmacists, we know a lot of times we're sending recommendations to the provider and they have a long list of recommendations of things to address. But with everything else going on, that list might be a long list for a long time. And so by having a CPA, it allows you to take action a little bit more independently. So I think that's really unique. But it also allows you to participate more in the value-based care model of being able to impact those outcomes, because again, we're not just waiting for things to happen. We are able to make those changes, whether it's to medications or addressing specific needs that patients have in ordering labs. You're not waiting for just a signature from a provider or a sign off on that. So I think that's really where we've been able to see the benefit in working with providers through CPPs and through CPAs that we have with the providers that we work with. And I think one of the other things in terms of your question about our involvement in advocacy efforts, I will say our big driving force for this is, of course, our pharmacy owner. And she speaks locally as well as nationally on really efforts that push the needle for pharmacists and expansion in the scope of the role of the pharmacist. And I think that really is driven by what our pharmacists are doing on a daily basis. Because while Amina might be in and out of the pharmacy and in and out of the clinics at times, she's not there day in, day out, meeting with patients because she has all sorts of things that she's involved in. But she really pulls together all of the experience of our teams in working in different practice settings, whether that's primary care, specialty, FQHCs, RHCs, you name it, all of the, alphabet soup of practice types. But she really advocates for the data that really highlights the value of the pharmacist. So we're not just saying we're valuable, but what are the outcomes that we're able to achieve? What is that trend from baseline to, 6 months down the road? What does that look like? And how can we share that data to support how pharmacists can play a role in patient care? So I think it's great that we've seen success in a lot of these models, whether that's, primary care and beyond. And we've seen that in a variety of different states as well. So of course we have North Carolina as our home base, but sites as well as in South Carolina too. So with that, I'd like to hand things over to Mariana to share a little bit more on her perspective.
Yeah, thanks. I would just say, being in that day-to-day in the clinic setting most of the time, I do see providers getting overwhelmed with all of the things they have to do. You mentioned earlier about their long list of things, and we don't want to add to that necessarily as a pharmacist, but we do want to help take care of the patient to the best of our ability. So just the other day, I spent an hour and a half with a very anxious patient, kind of teaching her about not only just the diabetes, but the new injection she was starting and helping fill in those gaps in her knowledge. And it was just a really rewarding experience because providers unfortunately aren't able to spend that time with their patients, but it entrusted me as a pharmacist to fill in those gaps for that one patient in particular. But we've also worked with CPPs who kind of work that gap or adherence measure list or whatever it may be, whether that's preventative care, things like mammograms, colonoscopies, all sorts of things, filling those gaps at a population health level. And that just helps us win for everyone, the patients, the providers, and the pharmacists.
That's awesome. Very wonderful for the advocacy piece, because we can't have enough advocacy for our profession of pharmacy, right? All right, now let's dive into the topic of provider status for pharmacists. Can you both explain, or one of you explain, the difference between state level and national level provider status for pharmacists and what it currently looks like? And maybe start with the state that you are specifically licensed in or where you're most familiar with, and then go broad from there, however broad or narrow you want to be with this.
Yeah, I'm definitely happy to start with North Carolina because that is our home base. And as far as opportunities in North Carolina, thankfully, those opportunities are very diverse, very expanded. And I think that's one of the reasons why a lot of pharmacists are interested in moving to North Carolina for that expanded scope. I know for me, when I was looking into residency programs, I specifically targeted North Carolina. And that was one of the reasons. Of course, it's a beautiful state as well. But in thinking about the scope of the pharmacist in North Carolina in particular, as an example, we have that designation, like you mentioned before, Micaela, the clinical pharmacist practitioner. And so through that, you have the opportunity to collaborate with providers and bill for your services through Medicaid. So Medicaid has a pretty extensive fee schedule for CPPs to be able to bill directly for their services. And I think it's really nice because it's very transparent as far as what procedures and services a pharmacist is able to conduct and bill under their own NPI. And so that's what we kind of look at in terms of that state scope, but it can vary quite a bit from one state to another in terms of what those opportunities look like. So Marianna, I didn't know if you wanted to kind of compare and contrast for what you've seen in North Carolina to your experiences in South Carolina, since you have seen both of those sides.
Yeah, so unfortunately, South Carolina doesn't have any sort of CPP or provider status. It is something we're working towards. In fact, the clinic I am currently with is a rural health clinic, and in collaboration with the South Carolina Office of Rural Health, we were under a grant for some time, hoping to gather some data about what a pharmacist can do for the Medicaid population. And there's some things we could bill for, but it's not necessarily billing directly under our own NPI or kind of those evaluation and management services. But we are collecting that data in order to go back to South Carolina Medicaid and say, we can do all of these things for your patients. We can help the providers out, especially. So it's something we're working on, but it is nice seeing that another southern state just across the border, North Carolina, can do it. So it definitely helps us down here in South Carolina.
And to kind of touch on when you think about the national scope and how it's a little bit different from what we see on a state level, states might recognize pharmacists to be able to bill directly for their services, but we think about the legislation supporting pharmacists, but then also the payment side. So those are kind of two separate pieces, because just because the legislation allows you to do those things doesn't mean the payers recognize you. So in North Carolina, Medicaid allows you to bill for those services, but that doesn't mean that private payers have a full scope for pharmacists to be able to conduct and bill for these services on their own. So we see differences in state to state, where there might be one state where you see more opportunities with private payers versus others that allow that expanded scope for Medicaid. And then also nationally, of course, we don't have that recognition as a provider with some of those biggest payers we think about, like Medicare. So pharmacists are not able to directly bill for their services outside of what we think of like MTM services or DSME for diabetes self-management education. That's kind of what people typically think about. And Medicare currently doesn't recognize pharmacists to be able to conduct and bill things independently outside of those service sets. So it is a little bit unique, and really all of the pharmacy organizations are kind of coming together and pushing for advocacy to be recognized on that national level. But fortunately, we do see more opportunities in terms of what the states have individually recognized to be within a scope of a pharmacist. And so, of course, again, varies quite a bit from state to state, but great to see that most states have that expanded opportunity. And I think last year was the first year where all 50 states had some sort of opportunity for pharmacists to pursue additional clinical services and had that collaborative agreement. But whether or not it allows you to kind of have a full scope where you can directly bill, that is kind of something that we're hoping to see continue to expand as national efforts are pushed.
Exciting to hear and see for our profession. And I did 2 ambulatory care residencies in North Carolina and was very familiar with working under pharmacists with the CPP. And it was really interesting to go into, I work in a transplant clinic and in the inpatient setting within the transplant team, in an MUSC affiliated regional hospital. So it's called the Mid-Carolinas Transplant Center. We do kidney transplants. And it's really interesting to see the difference. So we don't have a CPP, but the providers and this clinic and team in particular, they are all one team. So like we do everything together. We have a very collaborative office. I mean, I'm in the office with a registered dietitian, the other pharmacist and nurse practitioner, and the providers are constantly in there. We collaborate like all the time. They're asking the pharmacist questions, the dietitian questions. Everybody's kind of making a decision collectively on the patient, and we come together and have like brainstorm meetings, and then we walk over and round together after we eat lunch together. It's just really cool to see the difference in a CPP. And I kind of came to South Carolina wondering, okay, how much autonomy am I going to have as a pharmacist? And it's been almost, I would say, as much, but it's still under the provider has the final say, obviously, but they have a lot of, they rely heavily on pharmacists, which I love to see that collaborative practice, even though, we don't technically have a collaborative practice agreement. So something that is just a step in the right direction for just moving toward more autonomy for pharmacists. And I love it. Okay. Next, we're going to go into the future outlook and steps toward provider status. And I know we had mentioned talking about one follow-up question that I wanted to ask. So is there anything that pharmacists should know or be doing now from an advocacy perspective regarding collaborative practice agreements?
Yeah, I think in terms of advocacy for collaborative practice agreements, it's important for pharmacists to be involved in clinical services now, because we talked a little bit about the data to support pharmacists in these roles. And with more data, you're able to present that value rather than just say, if we were to be in these roles and practicing in this way, this is what we anticipate would happen. To have that data, I know, Mariana, you mentioned being at the RHC and really trying to participate in sharing that data on a larger scale so that people can start to see what the outcomes look like. I think that is one of the biggest things that pharmacists can do now and take that active role. So a lot of clinical services don't require you to have a collaborative practice agreement. And I think, Micaela, you're talking about this in terms of how you collaborate with providers, but the provider might still have the final say. But there are a lot of studies out there to show the data that pharmacists being added to the team do make a difference in terms of the outcomes for patients. And interdisciplinary care, when that pharmacist is added on, the outcomes are usually superior. So it is nice to see that even without CPAs, you can still participate in these collaborative models and continue to show how pharmacists can help achieve disease state outcomes, whether that's blood pressure control, A1C control. It takes a village to really navigate the healthcare system in the United States. And so by pulling together all of the skill sets that each of the team members has, I think everyone is better for it, whether that be the provider in terms of their workload, the pharmacist in terms of that expanded scope and opportunity to really utilize and the knowledge that we have and work at the top of our license, and the patient in terms of really improving and being more knowledgeable about their care and how to self-manage their conditions, because someone was able to take the time to talk with them and really get to know them and what drives them. I think with everyone coming together, we're really able to utilize all of those skill sets.
Yeah, that's a really great perspective. It definitely takes a village to help our patients. And just you talking about the data that shows a pharmacist on the team helps to improve outcomes. Medicare requires a pharmacist to be on the transplant team because of the data that's shown a pharmacist helps their patients, and they're trying to help reduce costs for Medicare, right? So that just is showing that pharmacists make a difference. And, registered dietitian is required as well. So it takes a village. We need all our people on a team to help these patients. All right, looking ahead, what do you envision for the future for provider status for pharmacists, and what steps can pharmacists be taking now to move toward provider status?
I think the biggest thing that stands out to me is that we are seeing a lot more individual providers supporting pharmacists in this capacity once they've had that experience of working alongside a pharmacist. And we might see some differences in opinions between pharmacy organizations and medical organizations on, scope creep is something that they refer to often in terms of a concern of pharmacists taking on these expanded roles. But I don't think that's what we see when we look at an individual practice and how they work together with the pharmacist and see those, positive outcomes. So I think by pharmacists actively taking on those roles, working more closely with providers locally and in their area to be able to advocate for, the services that they're able to offer and what it means to work with a pharmacist in this capacity, I think we will start to see that future take shape of where providers are more accepting, because, there's a significant need for patients. And when we think about limited access to care, that's one of the big concerns that we have in the US healthcare system. So by pharmacists really taking that step forward, and even if it's, starting with something small, whether that's one service set to be able to show how you can work together with them. Maybe that's chronic care management in a service with a lot of flexibility where you don't need a full collaborative practice agreement to be able to function, but you're still able to prove how a pharmacist can add value. I think that's one step that really moves us in the right direction, because if this is done on a very small scale where we have that authority and we have the CPAs, but no one's utilizing them, we're not going to see those outcomes and we're not going to see the benefit. And if they see, well, you have that, we've passed the legislation, but no one's utilizing this, they're more likely to take a step back. But if pharmacists are actively pursuing these opportunities, even if it's a small step forward for yourself as an individual or as an organization, I think those are some really important pieces to think about right now.
Yeah, that's so important and a great perspective to have on that. I really appreciate your insight. Okay, now I want to know, as we wrap up, what advice or tips do you have for both new and seasoned pharmacist practitioners when it comes to navigating CPAs and working toward provider status?
For me, when I think about pharmacy as a whole, things are starting to change very rapidly, and that's true of CPAs and opportunities as well. So I think staying on top of any changes within your state, as well as those efforts that are kind of pursued by pharmacy organizations on a national level, whether that's signing up for a newsletter and staying on top of it in terms of reading those updates and being aware, I think that's something that you can do right now. And as far as the kind of that active role in participation, I think exploring what opportunities can help pharmacists take that next step, whether it's, enhanced clinical services opportunity with a payer in your area, making sure that you're conducting those services to the best of your ability and being able to collect those outcomes. I know that there are opportunities for community pharmacies, for ambulatory care pharmacists, in a variety of states for these expanded opportunities. So taking on those active roles, doing the best that you can and navigating those programs, improving those outcomes, I think that's really important. And then for newer practitioners who are kind of coming out of pharmacy school, pursuing those opportunities that allow you to collaborate with providers in this fashion, whether it's a residency program, whether it's a fellowship program, I think they're really designed to highlight the benefit of working together. And we see where a lot of new providers, they've never functioned in a world where there aren't pharmacists on the team. And that's what we're hoping to see more of, where providers and pharmacists, they see this as the norm. And I think I'm really excited to see that as we start to grow and as we see more opportunities for this expanded pharmacist scope.
Yeah, Jessica, I'm glad you highlighted the community pharmacist too, because change is coming and there's so many different ways technology may be integrated and their role may not look the same, and even 5 years from now. But I think just showing up for their patients every day, whether that's taking on new opportunities, like I know in South Carolina recently we've got the oral contraceptive prescribing, or if your state has the point of care testing, just showing up and being a resource for the patients, especially like you mentioned earlier too, Jessica, with the projected shortage of primary care physicians. We want to make sure these community pharmacists are around, and keeping their business open, and collaboration is one way to do that, but also embracing change and making sure we're just staying involved with what's coming down the pipeline.
Yeah, that's wonderful perspective. I love it how you incorporated community pharmacists in. And, you know, I heard someone speaking on this topic of collaborative practice agreements and how, you know, inching toward provider status, we really have to utilize what we have available to us right now and kind of show like, hey, you gave us these collaborative practice agreements. Look what we've done. Look what we can do if we're expanded even further, and kind of showing that there's a need for an additional member on this team. Like you said, we're not trained like the other diagnosticians. We're trained in a different way. And if you think about it, like a nurse practitioner, a physician, a PA, they're all like the fingers, and the pharmacist is like the thumb, and it has a different perspective to make a better holistic hand. We can bring our own perspective in to really help our patients and help our provider team take better care of our patients and improve outcomes, just like you have been saying. So that's really exciting to see, you know, Amina and of the Avant team and you guys really just advocating and showing pharmacists what we can do, and being a tool and a resource to help pharmacists really progress our profession. Because as we learn and as we share, we make a difference together, right? For our patients. That's ultimately the goal. So it's been an absolute pleasure. I would say you guys are definitely pharmacy friends of mine, and I'm so glad to have had this hour with you guys to talk about collaborative practice agreements and provider status. It's been an absolute pleasure talking to you guys. But feel free to shout out anything you guys are doing, your personal ways that people can reach you, or the Avant company or pharmacy or institute, everything that you're doing. Shout it out.
Of course. So the Institute side, we have, of course, our website, which is probably the first place that people can go to find more information on who we are, what we do, and how to connect with us. We are on social media as well, personally through LinkedIn, and we also do have our business pages. And we do have an Instagram page that we try to keep up with as best as possible, and really highlighting, you know, important tips and tricks for pharmacists who are in this space, advocating for kind of upcoming events that we have going on for the Institute. So that really is one of the best ways to keep up to date on kind of things that we're working on. But Mariana, I know one of the things that we got to work on together was the APHA CTP. So I didn't know if you wanted to talk a little bit about that too.
Yeah, if you're interested in hearing more about how to get paid for working collaboratively, that's part of the APHA program, a certificate training program on how pharmacists can get paid through collaborative clinical services. So we have that. We have our upcoming symposium as well in 2025. You can find all of that on our website. We're excited for seeing many of you there. And if you're ever at any other pharmacy conferences and you happen to see either Amina Abubakar or Sesfat Kabisapati on the speaking agenda, they're part of our team and always at these conferences. So definitely connect with us and tell them Mariana and Jessica sent you.
Yes, definitely. Well, thank you both for being here today. And thank you to our audience for tuning in to another episode of the Farm So Hard Ambulatory Care Podcast. If you enjoyed this episode and you're looking for more, don't forget to subscribe and like and share with your ambulatory care friends. Also, comment any questions that you have or follow-up discussions or new topics that you want to hear more on. And until then, don't forget to farm so hard in ambulatory care. And we absolutely love this community so we can learn and share and make a difference together. Until next time, fam. Thanks so much.
So I farm so hard, the employees wanna find me, and then wanna hire me. What's 100K to a guy like me? Could you please remind me? Farm so hard, this ain't easy. Working late nights, you best believe me. My grades can only go A's. Never wanna see another B unless I'm Jay-Z. Farm so hard, let's get paid.
This is Morgan Greer. This is Micaela Hayes, and you're listening to another episode of the Farm So Hard Ambulatory Care Podcast.